Uh, Okay,
Go ahead.
got it. Okay. Got it. Okay. All right. Okay to go ahead?
Yep.
Okay. And we're interested in this because the
Yeah.
focus of the Pima County Sheriff's Office is to keep those with mental illness out of jail and get them into treatment access. So our presenter today is Detective Fabiola Iago. She's part of the mental health support team and a member of the Pima County Sheriff Mental Health Support Team. So one of the things that Aaron and I talked about, I thought was interesting, was you folks not only providing the crisis intervention training, but in engaging in follow-up with individuals with mental health issues and working with case managers and providing access to community resources for assistance with treatment. So anyway, so go ahead and start with what you were going to do, Fabiola, and welcome to, we're glad to have you here.
Fabiola, you're muted.
Uh,
On your far left-hand corner, there should be a mic.
Okay, here we go. Here we go. I got it. Can you hear me now? Can you hear me now?
Yes, we can.
yeah.
Okay, so I can barely hear you. So if I missed something, please repeat. Or if you have any questions, just let me know. My audio is not the best on my laptop that they provided us here. So but I'm going to go ahead and start. Of course, my name is Fabiola Igo. I work with the mental health team here at the Sheriff's Department. I've been a deputy for 15 years and a detective for 2 years. I've been in the mental health team for 2.5 years now. So to start off, what is a mental health support team? So it's a unique team changing law enforcement approach and philosophy in handling a person in crisis. And so our team is made out of these, all of us together. There's a sergeant, of course, Sergeant Eric Gibson. We do have a civilian, I call her administrative assistant, but her title here at the Sheriff's Department is a PSS, and her name is Melissa Upton. We have 3 other detectives, apart from myself, Detective Brad Judd, Ethan Nosek, and Laura Gill. We do also have other detectives from other agencies, and usually there are a contact in that jurisdiction in case we have anyone with mental health that we need to follow up on. We are supposed to have 2 other deputies part of this team, but unfortunately with manpower and staff leaving, there's only 4 of us. And so we'll do, and I'll get into what we more do, but usually the deputies on the field side, we had 2 deputies doing the mental health orders, and we were doing the follow-up. But for now, we only have the 4 detectives. Before mental health support team came about, patrol deputies would look for the quickest and easiest solution to the situation with the mental health nexus. It often resulted in arrest and incarceration. As a result, the Pima County Jail is now the largest behavioral health facility in Southern Arizona. The wave of mass shootings and the increased mental health related calls served as a catalyst for taking a fresh look at how we were doing things. And I just want to mention that if I go too fast, please slow me down. If you have any questions or you didn't understand something, please let me know. Okay, so these events happen, why we change our philosophy in doing things. We did have this mass shooting. I apologize. I just went too far. The 3 nurses, professionals killed at the University Medical Center. I don't know if you all remember that. And this was done by Robert Flores, who had mental health problems and had contact with law enforcement. We have one of our own, Timothy Graham, in 2005. He was, I think he got combative, or Aaron Swayers got combative with Timothy Graham, which ended and resulted with Timothy Graham dying. We also have Eric Height in 2008. His contact with David Delick. This person also had mental health and a lot of law enforcement contact. Next, we have the Gabby Giffords mass shooting, which was in 2011. This resulted in 6 killed and 19 wounded. Jared Loeffner had a lot of mental health problems. Here's a few of the things that he had. The bottom one is more important because there was some law enforcement. If we would have taken a different approach on mental health, I don't believe that the shooting would have happened. But he was observed at the Pima County campus displaying these kinds of behaviors, but nothing was done about it. I guess he was trespassed from the campus, was asked to get a mental health evaluation, but instead he dropped out of school, which then resulted into the mass shooting. I was there when it happened. I was one of the officers at the time that responded there, and it was horrific. I mean, it was horrible to see, and to see especially Christina Green getting killed. So because of all these mass shootings, the Sheriff's Department philosophy shifted. The Sheriff's Department recognized the need to take a different approach to mental health issues related to law enforcement. So we needed to decrease the risk of our officers and deputies and decrease the risk to the community and break that cycle that we had before, where deputies either incarcerated or took them to jail and then they were released. So our goals on this philosophy shift was to improve our officer safety, improve the community safety, identify and intervene sooner when possible, and instead of identifying that there's a problem afterwards. So the outcome of this philosophy shift was creating a mental health team that will create a nexus between the criminal justice and behavioral health fields. So we realized that early intervention has been cited as a missed opportunity in the past mass shooting events. Our mission at PCSD is to ensure that the individuals with mental health challenges receive the necessary treatment, support through a collaborative effort with behavioral professionals, law enforcement, medical practitioners, judicial entities, and the public. So our goal in this is to identify, intervene, and refer to behavioral health when possible, reduce the risk to the first responders and to the community, bridge the gap in situations with both criminal component and the mental health crisis is present, and then also to get that person in crisis the help needed while addressing the crime if the crime is involved. Usually we try to get that before that happens, but sometimes that doesn't quite happen majority of the time. So the initial call. And so if there is a criminal investigation, we start a criminal investigation, we present it to prosecutors, and then there's the adjudication of mental health diversion if there's mental health nexus involved with the criminal investigation. Or we might get an initial call and it's a mental health investigation. And so we start the mental health investigation, and then we present the facts, the observations to an evaluating provider, and hopefully by doing that we get a long-term care medication. Does anybody have any questions so far? I'm sorry, I didn't hear anybody. Does anybody have questions?
No.
None. Thank you.
Okay, so I'm sorry. All right. Can you hear me okay?
Yes.
Yes.
Okay. So before MIST, civil or street deputies were tasked with contacting mental health agencies, requesting assistance. Now we have the ability here in MIST to do follow-up, get contact information for caseworkers, and also get the agencies and also get the name of the agencies or where they are enrolled as a patient. Since 2012, the Pima County Sheriff's Department Health Support has served thousands of mental health petitions and transported subjects to facilities without using force. Most of our MIST team has served since 2012 about 47,000 orders and over 8,000 transports to facilities.
Fabiola, I'd like to ask a question now. if I
Duties in the
can.
MIST unit. So we
Um,
have the deputy. Yes,
uh,
absolutely.
Yes, the question has to do with the transport to facilities. Is it primarily the crisis response center, or are there other hospitals and so forth that you send them or transport them to?
There's of course the crisis response center, and we also have a Banner South Campus Behavioral Health, which they have a psychiatric unit. There's Palo Verde mental health facility, which is on Craycroft and by TMC, right behind TMC. There's also Sonora Behavioral Health Agency that's also behind Northwest. And am I missing one? Which one? Sorry, Detective Judd's here with me. And those are the four, right? So yeah, 4 agencies that we usually send someone to. And it also depends on the mental health order, but we'll get into the mental health orders here shortly. Does that answer your question?
Yes, it does. Thank you.
You're welcome. All right, so we don't have deputies right now doing the mental health pickups, but as detectives, we follow up on assigned cases by meeting with the subjects in the field, researching documents. Let's see here. Give me a second here. All right, there we go. Contacting and sharing information with case managers, contacting family members who may assist, check databases for more contacts, meaning assigned to people or incidents they've had with that person. And we assign we as detectives are assigned people to monitor the contacts with law enforcement on the field. So both deputies and detectives write petitions and provide expert resources for deputies in the field and help guide them through the process. We also do our training to our own deputies, corrections officer, and dispatchers on how to handle a person with the mental health nexus. So we're going to get into what we here at the Sheriff's Department, what we mainly do, and we have the mental health orders. So under Arizona Revised Statute 36-524, an emergency petition. As you can see, that it's a paperwork completed to initiate an emergency evaluation of a person who, based on behavior, is believed to be a danger to self or a danger to others. And that's pretty much it. But then it gives you more of the definition. I don't know if you would like me to read it, keep reading it, but if you take just a second to read the rest of it, if you have any questions, we do on these emergency petitions are usually done by deputies on the field. If they feel that this person needs to go in right away, they'll call a doctor at the crisis center and let them know their observations. And then if the doctor gives them the go ahead, then they are able to take that person into the CRC, and then they'll fill out the petition there at the CRC. Does anybody have a question regarding the mental health emergency petition? Okay. All right, so I'll continue on. We also have an involuntary petition, we call it the PAD. So the application for involuntary evaluation is a paperwork completed usually by us, or it can be completed by a professional person like a doctor, a caseworker, or even a family member. And this one is a request for an evaluation of a person who's alleged to be persistently or acutely disabled, or gravely disabled, or they might be alleged to be a danger to others or to themselves. When that happens, then you fill out this petition, and it has to meet the following criteria, the criteria that's listed on my presentation. So if not treated, has a substantially probability of causing the person to suffer or to continue to suffer severe and abnormal mental health, emotional, or physical harm. And it goes on. And we have, for us to fill out the petition or for a professional, or a family member, or a friend, all those criteria has to meet. I usually, when we fill out petitions or when the public fill out the petition, Crisis Center can help out. The crisis mobile team helps out in filling those out. We ourselves fill them out, and then we also get them notarized. And that's where we take these orders, these involuntary orders, we take them to our governing mental health agency, which is CBI. CBI tries to make the attempt on to contact that person, maybe interview them. And if they can't get that contact, or if they do have the contact and they feel like this person needs to be in some kind of mental health, needs more of a mental health resources, then they'll send it to the courts. The judge reviews it. And once the judge reviews it, he will either accept it. And if it gets accepted, then this mental health order comes out and we have to serve it. As police officers have to serve this mental health order and transport that person to any of the facilities, which is Palo Verde, Sonora, Banner South, or the Crisis Center.
Yeah. Yeah.
Another type of mental health order, I'm sorry, I apologize. Let me go back. So the court order treatments, these come about once the judge okays that petition, then that person might, after extensive evaluation from a doctor, once they get into the hospitals, if they believe they have to be court ordered to get treatment because that person is not willing to engage in services, then they, by the state, are ordered to be on this treatment for a year. And this is where the court order treatment then comes out. If they fail to continue with that court order treatment, once it's been imposed on them, then an amendment to an outpatient portion of a court order, which is what we call a revocation, comes out, and then we have to follow up and take that person back to the CRC. It's usually the CRC, I apologize. It's usually the CRC that we, I am so sorry. I moved away from wherever I was at. Let me go back to it. Oh my goodness. Thank you for your patience. So once we have that person, we have to go find that person and take them back to the CRC so they can be in compliance of the court order treatment. And so continuing on, actually, that's pretty much it. And does anybody have any questions? I apologize, I went kind of fast, but you are my first group of persons that I've actually presented this to.
Could we have an example of somebody who had been arrested and had signs of mental illness? Then that person would be taken to the CRC and assessment would happen. Is that right?
Correct. Usually, and usually that person doesn't have to be arrested. If we are out in the field and it's called, for whatever reason, we're doing a check welfare, and this person is displaying behavior, we will call the CRC and then we'll take them there. If there is a criminal component involved, let's say trespassing, if that person's been trespassed many times from a place, and by now he gets a charge for trespassing, then what happens is that they get taken to the jail. A petition will be filled out, and once they take care of the criminal side, meaning once they saw the judge and once they get their new court date, then the jail automatically takes them over to the CRC to get evaluated.
Okay, now when they go to the CRC, it's my understanding they can only stay the most longest they can stay is 24 hours. Is that right?
Correct. So
Okay.
the CRC is mostly a place where you take them to get the
They-
evaluation, maybe somebody sees them. Because we do get orders that they're at the CRC, once you get them there, that we have to serve. And from there, if the doctor doesn't feel that they need an extensive evaluation, then they release them. Now, if they feel that this person is going to be a danger to self or others, or needs some kind of more extensive help, then they'll do a second set, with what we call a second set, but it's a second evaluation by a doctor at one of the behavioral health hospitals. And that's how sometimes they just move on from the CRC to get a more of extensive evaluation.
Okay, and then how do you determine, or the CRC determine, if that person needs a more extensive evaluation? And
They have somebody there that's gonna do an investigation, like an evaluation, a mini evaluation. We'll talk to them, would get the information that they need, and with their observations, if they feel that this person needs to have more of a help, then they move from the CRC over to a behavioral health agency that will do an extensive with a psychiatrist, who then will do, I don't exactly know what they do, but I know that they talk to them and whatever else psychiatrists do.
Okay, all right, thank you. Yeah.
Does anybody else have any questions?
I would like to know how you're linking with the new suicide prevention line, the 988 number, and how that the sheriff's office is.
How is that?
Yeah,
I honestly, do you know any info?
It's still going through our 911 dispatch system at this point, but it usually gets you into the crisis line. rather than
Okay.
to-
So the only information we have is that it goes through our communications system, meaning that if they call in and they determine that that they need the crisis line, then they'll transfer it over to the crisis line.
okay. And there's somebody.
And that's all the information I have.
And there's trained
sorry?
staff there to take, to talk with a person who's in the crisis, is that right? With the 988 number.
Correct. I believe that I believe that they're putting a mental health professional.
We're working on it, yeah.
Yes, I believe that they're gonna will determine if this needs to be handled out in the field by our deputies, or if it can go to the crisis center or the crisis line, and go that end, on that end. So
And that would make
Anybody
local connection then, yeah.
well,
okay.
that will cause less work for us, especially because there are calls where we've gone and clearly they need the crisis center. They're not in danger to themselves or anyone else. So that having that resources is great, because it unties us from it gives us a chance to go to something else that needs our attention right away. And with manpower, with manpower being low, we need a resource like that to filter calls that only need the crisis line. Now, if they need us there because that person is threatening, or for whatever reason we feel like they're going to be a danger to the public, then we'll go out there and help out.
Mhm. Yeah, okay. Other people jump in if you have questions here. I don't
Yes,
wanna
but
monopolize it. But Aaron said that you also.
and I went a little too, like I said.
Aaron said you work with case managers to.
Correct.
Yeah, can you tell me how that works?
So what happens is when we get the calls and the communications dispatch the officers over to the address, sometimes the deputies that respond will determine if this call is in a criminal investigation or a mental health investigation. So they will flag our calls either criminal or mental health, or it can be both. They might do that. And so what would happen is, and then that call gets sent to the appropriate units. So if they tag it mental health, then it's going to come to us where Erin sees it. Erin looks at it and says, okay, there's definitely, this is a person that needs some kind of resources. And then she'll send it out to one of our detectives, which is myself included. And then from there, we'll look into it. We'll see if that person is enrolled somewhere, or if they're not enrolled, because we have the access of calling a number that we have with Arizona Complete Health. And we call them and say, hey, we have this person by this name, this date. Can you please let us know if they're enrolled in any kind of behavioral health services? If they say yes, then most likely they'll say, hey, they are enrolled with COPE or La Frontera. What's the other one? A Kodak. And so we'll call those agencies and ask, hey, we'll call them and ask them, is this person been active? Because sometimes they might be enrolled with that agency, but they haven't seen them for 2 months, or they haven't made contact in more than a month. And so what happens is that then we with the case manager, we try to do something about getting that person back into the resources, because they've been calling a lot, or they've been seeing the aliens, or they've been seeing people in their walls, whatever the call is. We try to find some kind of solution with their case managers if they're enrolled. And if they're not enrolled, then what we try to do with the information that our deputies have provided with history of us going to the addresses, we'll get that information and put in a petition, or go visit them and talk to them and see if they are willing to get services and connect them up to an agency, because some of those agencies will come out and will offer those services to them.
Okay, good, thank you.
You're welcome. Anybody else have?
Questions?
Nobody?
Yeah,
Yes.
I guess my question is not so much about what you're doing when there's a sheriff's department intervention, but what follows that. And that seems to be the place where it's breaking down, that we don't have enough resources to treat the people who need long-term treatment.
Right. And and like anything in my experience being here 2.5 years, the system is not perfect. If that person who needs that mental health resource, sometimes if they're involved in substance abuse, they release them because they're not going to take the chances of whatever they're on in their intoxication, give them something that might not help them, or might do something worse to them. So we see like a revolving door where we're bringing people in, but because they're on some kind of substance abuse, they can't really do much until that person is not not high, I guess is what we want to call it. They have to be sober, they have to be clean for them to give them that help that they need, because they can't judge in the evaluation if their mental health state, is it through drugs, or is it just, it's hard for them to determine where their stage is at, and recommend whatever medication they need. So then we see a lot of where we're bringing people in and they're releasing them because of that.
Yeah.
So and we need more resources. We need more like of a place where they're actually, at least for me, because everything has to be, if it's involuntary, we go through the courts, but we need in the court system for this judge to see, okay, we deal with this person a lot. We know part of the problem is they're not sober, they're on some kind of drug, or that we need somewhere where we can have them detox and then get the evaluation that they need. But that doesn't happen because we don't have it out there. We have detox places, a lot of them, but that person has to voluntarily agree to go to the detox. And at any point, they can say, I don't want to be here anymore, and they leave. And then the cycle starts up again, where they're displaying all these mental health behaviors, and we really can't do much about it unless they're willing to go voluntarily. Did that answer your question, Mr. Kemp?
Yeah, it does. And I want to tell you how much respect we have for the sheriff's department and
Thank
for
you,
your
sir.
pioneering efforts here.
It is very frustrating. You know, we try to we try to work with the behavioral health agencies a lot more. Like, for example, I'll give an example. Like yesterday, myself and Detective Judd went up to the north side. We had a lady who keeps sending the sheriff through the internet messages that did not make any sense. In her messages, she said she was part of La Frontera, but when I called Arizona Complete Health, they said, well, she hasn't been to any of the behavioral health agencies in a year. So I called La Frontera because she mentioned it, and sure enough, she is enrolled, but she voluntarily enrolled herself for substance abuse. So the last time they had seen her was a month and a half ago. So we go up there. Actually, La Frontera was willing to come with us, and we actually try to make contact. But the fact that the really neat thing about it is, like, some of these agencies have a team that will go out with us deputies. And I told this person, okay, so she left. We had talked to Dad, and we left our contact information. But the person from La Frontera, their crisis team, said, we'll come back, we'll do the assessment. I mean, she did voluntarily come to us, so we'll come. And then if we need to put a petition, then we will. And this is a great resources. We have that out there, and that's helpful, but it's frustrating because, you know, I did call Arizona Complete Health, and they're like, oh no, she has no contact. But yet, doing more research, I was able to find that she was part of La Frontera. So it gets frustrating because we don't get everything. Sometimes the information that we need is not there, but it is there because it's not updated in any system. I know that with legislation changes, there is a change where we're going to have a database, and I'm excited about it, where all law enforcement can share any information and look up, has that person in the past been court order treatment. So I'm excited for that, because that's going to come about, and that should be a new step in the right direction of us trying to get the persons out that have crisis help. So I'm excited. But thank you, Mr. Kemp.
You know, that's a very good example of what I was asking for too, in terms of how you connect with with various agencies and the amount of work, groundwork that you have to do in order to get the information. And I think that's a
Right.
lot of what people don't understand, is how the information is not compiled so that it's easy to
No.
know what kind of help somebody needs, or that they haven't had
Well,
help.
now with it,
Yeah.
right. It's just, like I said, I'm excited about this new thing that the Arizona State is doing, compiling a network where we, with us behavioral health agencies and ourselves, law enforcement, can look into the information without doing the HIPAA violation, because that's what you run into a lot. Sometimes they're like, well, this is a HIPAA violation. No, it's not. We're just trying to get resources to them. We're not asking you what they're, sometimes we tell them, you don't have to tell us what they're diagnosed, though we
Right.
get those orders, and we, you know, and it tells us there what they're diagnosed, because we have to go pick them up. But, you know, the only thing we're asking is, please let us know, have they been court ordered treatment before, or is there something that we should be worried about if we're going to make contact with this person? So it was a little frustrating, but now with the legislation changes in the ARS mental health section, I'm excited for this new, like I said, this new thing that they're going to put together. But we have a lot of that, where we have had in the past resistance from behavioral health agencies because of HIPAA. or their system not being updated for whatever reason. Sometimes we'll get like, oh, our system was down, and they can't give us the information. So here we are scrambling, trying to get any information that we can. We're trying to make contact with families. Sometimes families like, well, we haven't seen them. Some of the people that we deal with, they're homeless. They're homeless, and we once in a while we'll make contact with them out in the field because they went into the Circle K or were acting strangely by the side of the road. So it's frustrating because if we had that information, we're able to handle the calls more effectively. So.
Yeah, that's very good. Thank you. I appreciate that. I think that
You're
really
welcome.
illustrates the kind of thing that we are interested in. And our focus is on trying to give education to our community of people about what's available and to help reduce the stigma and to help people access whatever resources are available, even knowing that those resources in this community are slim.
Right.
So I guess my question is, how can we help you do your job?
Gosh, I guess, being proactive, calling us, letting us know, hey, we have a person here, calling 911. That way we have that contact, we have that information, because calling 911 and saying we have this person's acting strangely, we can go out there and assess the situation. Also, you don't have to call us. I know some people don't feel comfortable with calling 911. You could also call the crisis line. They'll send out a team, the crisis mobile team, and what they do is that they will go to the houses and they will talk to that person, assess them, and then if they feel like they need more resources, then they would either ask for us to transport because that person needs help right now, or they will put in a petition, and then that eventually comes out like probably like a week later after filling out the petition, and then we whoever's jurisdiction it is in, that law enforcement agency will go and pick up that person and take them to the appropriate behavioral health agency.
And you have crisis trained officers, so anybody calling that 988 number
I'm sorry.
would ask for a crisis trained officer, right? Is that right? Or
You can do that too. Yeah, absolutely. Or you can call us. I was like, I need to talk to the mental health team. We're
Okay.
all trained.
okay.
We do, myself and our other detective, Ethan Nosek, we teach mental health first aid, which mental health first aid is it's like CPR. We teach them the tools and skills on how to identify a person who's in crisis and what they need to do, the steps they need to take to get to that person, to resources needed.
Right, yeah, okay.
And this is anybody that comes out of the academy. So the academy for our corrections officers in the jail, the academy for our commissioned deputies, and also we also teach in the academy for our communications. So the ladies and gentlemen that answer our phones we also teach them mental health first aid.
Okay. And am I right in assuming that if someone calls 911 and says there's a person with a mental health crisis, they will be automatically transferred to 988?
Depending, what our communications will do, we'll ask you several questions. And if they determine that they just need the crisis line, and they'll transfer you over the crisis. If not, then they'll send us. And then initially when we get there, we might call out the crisis mobile team, or we will take them to the CRC depending on what the situation is.
Okay, so if we know that there's a mental health crisis, we should call 988 directly.
Correct.
Okay.
And so even if you don't call 911, you call 998. If 998, after getting the information from the person that's calling, says, oh, you know what, I believe we need law enforcement also, then they will plug us into that call and they'll call us back and say, okay, so we got this information through the 998 998 line, but we believe we need to have an officer there to stand by or to check this out, because it might be, they might feel like it's a little bit dangerous and they don't just want to send a regular civilian out there. Or we might just all go together and deal with the person that is having that crisis.
Okay, thank you.
You're welcome.
Okay, all right. Anybody else with questions?
The only question I have, about 20 years ago, there was a whole push to have live scans. That means that they could check immediately to see if a person had committed a crime or anything. And it seems to me that if that were ever to get through, and I think it failed because of money, that would be a great tool for determining whether or not this person had a previous history of having mental health problems.
I'm sorry, I didn't catch that. So 20 years ago, there was,
Especially in children's court.
okay,
I served as the pastor of an inner city church, and so we had a lot of problems there. There was a thing called live scan that was supposed to be going through.
okay,
And I think the reason that failed was because they ran out of money for the process. But it was a thing that immediately, once they got the system up and going, you could get instant report on anything that had happened to
oh, I
the
see.
person, if they committed a crime or if they were involved in family abuse or if they were involved in a mental health issue. And the whole thing was that this would tell immediately. So if the person were in another state and flew into Los Angeles County, they would be able to check immediately and see if yesterday that person in another state had a problem. And I guess that failed because they just couldn't get the funds to do
Right.
it.
I don't know about that, but I know that especially if that was in children's court, being that the children under on guardianship of their parents or whoever their guardian is, that's a little difficult to do. But I know that with the new legislation that's came out, they have some, apart from this shared program that they're doing, they also mentioned about having that information, at least with the mental health aspect, that they will have. So if a person comes from another state and this petition doesn't have to be done all over again, we can actually check the mental health status from another state or from another town here in Arizona. So that's pretty exciting because usually before, oh no, they're in the jurisdiction of Maricopa County, we can't do anything. Well, that's not going to be the case now. After September 24th is when the new legislation updates come out.
Yeah, that's
And
great. That's a real step forward in my
Yes,
mind.
it is. Absolutely. At least for us, it is because, we've had people that come from other towns or other cities and it's frustrating because we have no information on them. We know they're from California or we know they're from somewhere else, but they're going in the right direction. I believe we're not able to get that information right away from for example, California, but anywhere, if they are from the state of Arizona, but they came from, let's say, Yuma, we're able to get that information right away. And we don't have to, at least we don't have to start a petition over.
Yeah, right.
Our judges can now say, okay, you are in the system, we'll do something about it right away. So I don't know if that answered your question.
No,
Mr. Kennedy.
that's an interesting thing. I'm glad to see that's happened. I think that's a real.
Yes,
step
for us it is. It's great for us too. So
Yeah.
Very good. I appreciate this. This gives us a lot of new information, Fabiola.
you're welcome.
Yes. So any other questions? Okay, well, if that's all, we can leave early. Unless you need us to know anything more.
No, I want to thank you for allowing me to do this presentation. I know Erin was supposed to do it, but I did it myself. So it's great because we have this power presentation that I put together, or I tried to. And hopefully next time, if you have a bigger group or if anybody's interested in the mental health,
Yeah.
we were able to provide this information for you.
Well, we're glad of it too. Thank you very much.
And if you have any questions, please don't hesitate to call us. I did put my number at the end. Or just call the Sheriff's Department, the 351-4600, which is just the information line. If you need anybody from our mental health team, they will direct you to our PSS or our admin assistant, Melissa Upton. And she will get a hold of one of us and we'll call you back.
Do you have a hard copy of some of the things you're doing that you have told us about that? You can
From the
email
presentation,
us?
well, we do have pamphlets. We can send those out to, if you give me an address where I can send it, we can send out the pamphlets and some of the resources we have.
Yeah, okay. I will contact you. Is it a big packet or can I just get it in email or should I get it?
Or I believe we're able to scan and
Okay.
send it to you
Okay.
through email.
Okay,
We'll have Melissa do that for us. She's great
Yeah,
at doing that, doing that stuff.
that would be good. And then we can have a
So,
hard copy to look at and then
Correct.
also I can do a summary to send to people who were not able to be here today.
all right, sounds good.
Thanks,
Very
officer.
good.
Thank you. Have a
Yeah.
good day.
Thank you very much.
Bye-bye.
Bye.
Bye.